Gentlemen, let me ask you something important. If I told you that just 3 minutes a day, without pills, devices, prescriptions, or invasive treatments, could meaningfully improve your erection strength, bladder control, and masculine confidence over time, would you believe it? Most men wouldn't. And that disbelief is one of the reasons so many quietly lose something they never imagined they would. Erectile strength rarely disappears overnight. It fades slowly, subtly, almost politely, until one day you realize something feels different. By then, most men blame age and accept it as inevitable. But that is not the full truth. Today, I want to share one of the most overlooked, science-backed tools for male sexual health after 60. It is simple, free, and when done correctly, remarkably effective. This is information many men are never told, even by their doctors. Welcome back to the Men's Health Channel. If you're new here, this channel exists for one purpose: to help men over 50, 60, and beyond understand their bodies, protect their health, and regain confidence using science rather than shame. After decades working in urology, I can tell you something with absolute certainty. A man's confidence is deeply tied to how well his body functions, and sexual health plays a far greater role in that confidence than most men are willing to admit out loud. As men age, changes in erectile function are common. Blood vessels become less flexible, circulation slows, nerve signaling weakens, hormones shift. Erections may feel softer, take longer, or not last the way they once did. For many men, this creates frustration and embarrassment. Some stop initiating intimacy. Others avoid the topic entirely. Quietly, they worry about disappointing their partner or losing a part of their identity. If any of that sounds familiar, I want you to hear this clearly. You are not alone, and you are not powerless. Erectile function is influenced by many factors, including cardiovascular health, blood pressure, diabetes, stress, medications, and nerve health. But there is one foundational system that is frequently ignored, yet plays a critical role in erection firmness, duration, and control. That system is your pelvic floor. The pelvic floor muscles sit at the base of your pelvis, running from the pubic bone to the tailbone. They support the bladder, the bowel, the prostate, and the mechanisms involved in erection and ejaculation. When these muscles weaken, erections often become less firm and harder to maintain. When they are strong and responsive, blood flow improves, control improves, and overall performance improves. This is not speculation. This is established human physiology. The exercise that targets this system is commonly known as Kegel exercises. For years, Kegels were discussed almost exclusively in women's health, particularly after childbirth. But men, especially men over 60, benefit enormously from these exercises. They support erection quality, bladder control, prostate health, and ejaculatory control. Unfortunately, many men have never heard of them, or they have been taught incorrectly. When done incorrectly, they simply do not work, which is why learning proper technique matters. The first step is identifying the correct muscles. This is the most important part of the entire process. If you engage the wrong muscles, you will not get results. Imagine trying to stop the flow of urine midstream, or imagine preventing the passing of gas. The internal lifting and tightening sensation you feel is your pelvic floor. It is subtle and internal. It feels like a gentle upward lift, not a push. A very common mistake is tightening the abdomen, thighs, or buttocks. That is not what you want. This is not a hard clench. It is a controlled lift. Once you can reliably identify that sensation, you are ready to begin. The routine itself takes 3 minutes a day. It is designed to be simple, sustainable, and effective. You can do it sitting, standing, or lying down. You can do it at your desk, in your car, or while watching television. The only requirement is consistency. Like any muscle, the pelvic floor responds to regular, correct training. Begin by gently contracting your pelvic floor muscles and lifting upward. Hold that contraction for 3 to 5 seconds, then fully relax for the same amount of time. Do not rush the relaxation. That full release allows proper blood flow and muscle recovery. Repeat this cycle slowly and deliberately. This phase builds strength, endurance, and control. Next, perform rapid contractions and releases of the pelvic floor. Think of it like quickly turning a light switch on and off. Squeeze, release, release. Keep the movement controlled but fast, ensuring that each contraction is followed by a complete release. This improves the quick reflexes required for firm, responsive erections. Finally, contract the pelvic floor muscles and hold the contraction for as long as comfortably possible without holding your breath. Initially, aim for 10 to 15 seconds. Breathe normally, then fully relax before repeating. This phase builds stamina and staying power. That is the entire routine. 3 minutes a day. Simple, but powerful. The effectiveness lies not in complexity, but in consistency and proper execution. Now let's discuss why this works. During an erection, blood flows into the spongy tissues of the penis. For firmness and duration, that blood must remain trapped. The pelvic floor muscles, particularly the bulbocavernosus and ischiocavernosus muscles, play a key role in compressing the veins that allow blood to exit the penis. This process is known as venous occlusion. When these muscles are strong, they act like a natural pump and valve system, helping maintain firmness and duration. A stronger pelvic floor creates a stronger foundation, allowing everything built on top of it to perform better. These exercises also improve nerve sensitivity and coordination in the pelvic region. Better nerve communication means better sensation, improved control, and a more responsive erection. While exercise cannot change anatomical size, improved blood flow, firmness, and control can result in a fuller, more optimal erection that performs better and feels more reliable. It is about maximizing the function of what your body already has. The benefits extend beyond erections alone. A strong pelvic floor improves bladder control, helping reduce leakage or dribbling after urination. It can also improve ejaculatory control, giving men greater confidence and control during intimacy. This is a holistic improvement in male health, not a single-issue solution. There are, however, common mistakes that reduce effectiveness. Do not bear down or push. The movement should be an upward lift. Do not hold your breath, as this increases abdominal pressure and works against you. Avoid tensing other muscles such as the abdomen, thighs, or buttocks. Focus on isolation, and do not overdo it. More is not better. 3 minutes a day is sufficient, especially when starting. It is also essential to understand that while pelvic floor exercises are highly beneficial, they are not a replacement for medical care. Persistent erectile difficulties, pain, severe urinary symptoms, or discomfort require evaluation by a healthcare professional. Conditions such as heart disease, diabetes, hormonal imbalances, nerve damage, or prostate issues must be properly diagnosed and treated. Early medical intervention protects long-term health. Gentlemen, taking control of your health, even the parts we do not always talk about openly, is a sign of strength, not weakness. This 3-minute daily routine is a simple but powerful investment in your confidence, vitality, and overall well-being. When combined with a balanced diet, regular physical activity, good sleep, and stress management, it helps your body perform at its best. If this video helped you feel informed or empowered, support the channel by liking the video, subscribing, and turning on notifications so you do not miss future science-backed guidance for men over 60. Leave your questions or comments below. I read every single one, and many of your questions inspire future videos. In our next video, we will discuss prostate health, screening guidelines, and what every man needs to know to protect his health as he ages. Stay informed, stay healthy, and keep taking charge of your well-being.